Hi everyone, I'm here with Dr. Brady, one of our district psychologists, and Mrs. Valenzuela, one of our school counselors. Today we're here to bring some awareness on the National Eating Disorder Association's Eating Disorder Awareness Week.
So when we talk about eating disorders, we're looking at mental health conditions that can also really affect students on a physical health level. And this is something that impacts about 3 to 10% of young people, so it might be more common than you think. So I think when we look at having a general healthy outlook on food and exercise is definitely a good thing for all of us. But when we're talking about eating disorders, we're looking at students that are caught up in habits that are unhealthy and maybe even excessive, related to excessive dieting, excessive restriction of food intake, things like excessive exercising, or real obsessions with clean eating. Those unhealthy patterns and responses can actually result in those physical outcomes. So this can create something that causes physical harm to the person or to the student that can even go as far as resulting in hospitalization. So it's a topic that we really look at in a very serious way, and we're going to talk more about how we can support each other, support our friends, and make sure that students that are in need of assistance are able to get it.
So in this, it's important to remember that there's no reason you should feel any shame or guilt for going through any of these things. What can happen a lot of times is that we just get so consumed by a traumatic event like losing a loved one, experiencing depression or loneliness, or even just being busy with school, that we tend to lose control over our hunger cues or try to regain that control by being fixated on our weight and our appearance. So finding recovery comes with having emotional awareness and being willing to understand what's the root problem behind your disordered eating. There are plenty of resources here at our school, and I would really encourage you all to use them.
So as mentioned, there are a lot of resources that our school has to offer students. Whether you're the student that needs help or you're the student that's helping someone else, it's really important to know that we are here for you. If you are the student, just be honest with yourself, and if you're helping someone else, be honest with that person as well. Getting help for an eating disorder can take some time. It also will require a licensed professional to help you get through. We want to make sure that you are really in a position where you can get the care that you need depending on what you might be experiencing, whether it be with anxiety, eating disorders, depression. As a rule of thumb though, we really want students to understand the importance of dealing with those everyday stressors, and that's why we created the Wellness Room for students. This is an ability for us to work with you in a small group setting to really address the social emotional health of students, and a lot of that comes from having self-care, learning the strategies to take care of yourself and how to eat healthy, how to sleep, how to build relationships, how to do various things for yourself themed around wellness. We do have those 8 dimensions that we work on every single week. And the really nice thing is that we ask students what they want to talk about. So this can be something that in the future we talk about in further depth if students are interested. And of course, we would always refer out to those licensed professionals, places where we have partnerships and we know that you're going to get good care. We're able to do this by referring you to our USC telehealth services that we have right now for students on campus as well as off campus. We also refer out to Foothill Family Services. So if you have Medi-Cal, we can get you some free therapy. If you don't have Medi-Cal, we can help you talk to your parent or legal guardian about getting help through your insurance. We also have Foothill Family Services coming on campus to conduct the SMART groups, which are all about relationships, and really understanding your relationship with yourself is the great way to start if you're struggling with any of the things that we talked about. So don't be scared to ask for help. We are here to assist you, and if for some reason we can on our end, we will make sure that we send you to the licensed professionals who can.
So just as an added point of caution and advisement, I would just suggest for all of our students, if you're struggling with these issues, please reach out to an adult that you can trust. Certainly if you come up on campus to any of our support staff, we can help to point you in the right direction. One point of caution that I would put out there is be careful about what websites you're looking at if you are doing your own research or looking for support. There are chat groups and sites which on the surface appear to be supportive, but in fact do glorify unhealthy habits and are going to be counterproductive. So I would just encourage for all students, if they're going to be looking online and doing research, to start by looking at the NEDA website, National Eating Disorder Association. That's going to be really the safest place to start your search for support. But again, of course, if you are knowing that a friend is in distress or struggling with these issues, encourage your friend to reach out and talk to an adult that they can trust on campus.
If you or any of your friends are looking for more information, visit the NEDA website at nationaleatingdisorders.org. Their website provides amazing relapse and recovery stories, articles for loved ones, coaches, and educators who want to support, and body image workshops as well. Don't be afraid to reach out. We're here for you and here to provide you with the support you need. Have a great day.